Welcome, I'm Dr. Jeffrey Watson, and welcome back to the Healthbeat Show. I'll always say to you that your health is your wealth, and when you have your health, you have everything. Welcome back. We've got some real interesting things for you today. We're talking about how to live more comfortably. Stay tuned right here on the Healthbeat Show.
You have everything. Take my word, but I heard about the Healthbeat you're gonna be. How you wanna be? Show me how you will be. How you wanna be? Show me how you will be. Listen to the show, the more you'll know about your health, so body and mind. 'Cause the more
And welcome back to the Healthbeat Show. I'm Dr. Jeffrey Watson. We are glad to be back with you. During this time, all of you want to know how to remain healthy. And I'll always tell you that your health is your wealth. And when you have your health, you have everything. On the Healthbeat Show today, we are going to be talking about how to live comfortably, how to live out your life comfortably. Joining me will be some members from a wonderful organization, a hospice organization called Bristol Hospice. I like to think that that is a program, hospice, that helps you to live more comfortably. So joining me first, and we are keeping our social distancing here during this time of the COVID-19, so that we want to make sure that you understand about all the aspects of healthcare that are going on. Joining me, two wonderful people. The first one is Miss Mevish Sheikh. Miss Mevish Sheikh is a master's in social work, and she is their director of community development. Welcome to the Healthbeat Show, Miss Mevish Sheikh.
Thank you so much, Dr. Watson. Thank you for having us here.
Now tell me a little bit about your background.
So I started off in hospice after I graduated from my master's in social work. I started as a medical social worker in the field, working with patients and families closely, understanding their psychosocial needs. And then at some point, we realized that there was a disconnect between the first point of contact for hospice patients. And so they decided to put me in that role. So when I do meet with families now, I can explain to them everything that hospice would encompass, and I can also really get a better sense of where they are, what's going on with their lives, and go from there. So now I'm in the Director of Community Development role, where I go to different places, hospitals, clinics, work with doctors such as yourself, to see where the needs are for patients that need hospice and they need that extra support at home. We believe in embracing a reverence for life, where our mission statement is providing the most and best compassionate care and services at home to all our patients and families. If you need to speak to me or just get some more information, please call us directly at 510-573-4404, or feel free to visit our website at www.bristolhospice.com.
So you really are a first-line healthcare provider. In other words, you often get there first to help the family out. And so we praise you for that, particularly during this very difficult, challenging time of health. Now, here's a question, and I have to ask this question of myself many, many times. The word hospice is kind of scary. You know, there was a doctor by the name of Dr. Kevorkian. And Dr. Kevorkian, one of the things that he did was he assisted people with dying. And he'd give them IV morphine. And so I think some people think that hospice is some kind of situation that takes you out, something like that. What is hospice? Is it a hospital? Is it a house? Is it a facility? Is it a insurance? What is hospice? If you could explain it to me.
Of course. And that is something that a lot of people have a misconception about with hospice. Hospice is an all-encompassing supportive services program that is provided to patients and their families at a time which is critical and when they need it the most. If you have patients that have an illness where they do not wish to consider any more treatment, or they just want to be comfortable where they're at, that's when hospice can be introduced. As I mentioned before, it is extra supportive services at home. Now, when we say home, it is wherever the patient is, whether they be at their own home, at an assisted living, at a board-in care, at a skilled nursing facility. Our goal as the hospice team is to go where the patient calls home and provide this extra supportive services, which would involve nursing visits, LVNs, we have home health aides, a social worker, a chaplain. So we're addressing the patient's spiritual needs, medical needs, all kinds of stuff that's going on, not just with the patient, as I mentioned, but also with the families, and taking care of all of that wherever they reside.
You know, you've really almost given the definition of health. Health is a spiritual, socioeconomic, psychological, and physical state of well-being. And so this is a program that encompasses all of that, and it goes to where the patient is. So it can go to a nursing home, to a boarding care, to their house. It's not, you know, some people think a hospice is like a hostel or a building or something like that. But okay. Now, how would someone get this service? I mean, is it a situation that they could call you, just pick up the phone, and we'll give out your phone number, and call you and say, you know, my mom is sick, she's got Alzheimer's, I need some extra help, you know, and I just can't do it all by myself. Do you have to have, does your insurance have to offer it to you? Does a doctor have to write a prescription for it? Or can a patient or the family just call and say, listen, I need this extra help. Can you come and help me? How does one engage this kind of service?
Of course. And before I answer that, I just wanted to also address, you talked about insurances before. Hospice is covered by most insurances. It is a free service. It's a free program. And as you asked just now, so when a patient or the family feels that they're being really overwhelmed with what's going on, they can always call us first. Our direct callback number is 510-573-4404. And then they can ask just for a consult, which is when I would come in. I would give them all the information about the program, just a better understanding of what to expect. The next step would be reaching out to their primary care physician, such as yourself, if that be the case, and request what's called a doctor's evaluation and a hospice order. That is the only thing we would need to start that service for that patient. We also have our own medical director, which is Dr. Chopra, and if the family would like, she can take on as their primary care physician. But to get on the program is very simple. Just that one quick call to our office, and I always tell families I will take care of everything that is needed, including reaching out to their doctor, letting them know what's going on, and getting that order to start the service.
So you don't really have to wait for a doctor to make the decision, because a doctor doesn't always know all the issues going on in the home.
That is correct.
How difficult it is to bathe mom and to feed mom and to give mom the medicine and to get mom up and put mom down and all these kinds of things. So that's so important. The patient or the family could actually call hospice. You can come out. You then, or the family would then contact the doctor and say, hey, I need this extra help.
Exactly.
And they're going to come by or send you a request for this extra help, this referral form is what you called it, I guess.
Yes, that is correct. And
Okay.
and you're very right. A lot of the times the doctors may not know or may not have seen the patient for a month or 2 months where that decline or the trajectory of the illness has gone towards a decline. And so the families can go ahead and make that first call to us or me, and then we can reach out to the doctor for them. So basically do all the legwork that we can take away from them.
And then, on the other hand, there are times that the doctor might realize that this is not a curable disorder, and no matter what medication or what therapy we give, it's not going to get better, and I want you to have some extra help. So
Exactly.
sometimes the doctor may make that decision,
Yes.
particularly if there's not going to be a treatment that may cure them. Okay, we are here with Bristol Hospice and Miss Mevish Sheikh. She is a director of community development, a master's in social worker, and one of the first line healers that would come out to help with the family. Thank you so much for being with us, and we look forward to talking with you some more
Thank you.
right here on the Healthbeat Show.
For advertising and sponsorship opportunities, log on to healthbeattv.info.
I'm Dr. Jeffrey Watson. For more information, go to our website, healthbeattv.info. You'll hear more about the information that we're giving you on the Healthbeat Show.
Hart, what's going on? I'm leaving. Why? What did I do? Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit. Okay, I get it. I'll do better. Just, please, don't leave. Okay. But remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Stop! When you lick spoons and pacifiers, you share bacteria that causes tooth decay in your child's mouth.
Go, go, go!
These bacteria feed off sugar and leave behind acids that cause cavities, holes, and then pain. This assault is 100% preventable. Brush and floss twice a day to keep the cavities away. Moms, it's up to you. Healthy habits for a healthy smile.
When I was 6, my days were spent playing basketball. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke.
I'm Paul George, and I want you to spot a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911.
Protect the ones you love.
Spot a stroke fast.
The Healthbeat Show, sponsored by Watson Wellness Water. Your health is your wealth.
Welcome back to the Healthbeat Show. I'm Dr. Jeffrey Watson. We're talking some about hospice, getting some extra help in the home, in the nursing home, in the hospital, wherever the patient is. And with me today is Miss Grace Lizardo. She is the Director of Patient Care Services for Bristol Hospice. Welcome to the Healthbeat Show, Miss Lizardo.
Hi, Dr. Watson. Thank you for having us here.
Tell me a little bit about your background. I understand you're a nurse, actually, right?
Yes, doctor. So I graduated as Bachelor's Science of Nursing, and then I jumped off straight to skilled nursing facility where I spent most of the time, doing bedside care to the patient. And then something is just like calling me, to go to hospice. So I went to hospice. And then I started as a RN case manager. I worked closely with the patients and the families. And then as time went by, I became the Director of Patient Care Services.
So you really are one of the frontline healing people in that you go into the home as a nurse.
Yes.
Somebody's in there, they're sick. Now, we talked about this extra help. And what are the requirements for hospice? So does somebody have to be, we talked about the fact that some people think it's a Dr. Kevorkian to help you die. Is there a requirement that you have to be dying? And what are the disease states that qualify you for the program called hospice?
Mm-hmm. So usually once we hear from the primary care physicians, that they did everything for this patient, and then the family decided, okay, let's just focus on comfort care. So that's when hospice will take over, meaning we will coordinate everything with the primary care physicians, with our medical directors, and then the family, of course, with their goal of care moving forward.
So you can help them to get a bed, a shower chair, the medications, oxygen. What Miss Sheikh told us, that the preacher will come over.
Yes.
The nurses will come. So what kind of diseases are required? Can you just say, I'm tired, Mom poops too much, and I just need somebody to clean her up?
No. Okay.
Or do they have to have a medical diagnosis?
We need to have a medical diagnosis. The 5 most common diagnoses are cancer, number 1. Number 2 are heart failures. It could be congestive heart failure, and then COPD, we do have that, and then now the COVID-19. And then we also have Alzheimer's disease or dementia, and then the stroke patients.
Dementia, that's a big one, because
Yes.
people have a lot of difficulty taking care of someone who's confused and, difficult. Maybe they don't want to eat. Maybe they don't want to dress. Maybe they have a wound. So you come in and help them to take care of all of the different aspects of these disease states.
Yes, doctor.
Now, what about, sometimes people with cancer or heart problems or emphysema, or even the dementia patient or the stroke patient who's contracted and so on, they have a lot of pain, And the doctors, there's a lot of issues right now about doctors prescribing pain medicine. And so I've actually had a patient, and they've said, I'm in a lot of pain, I've had a stroke, I have congestive heart failure, I've contracted, I can't walk, and I need, previously I took these pain medicines, and I've said to them, the pharmacy won't prescribe, they won't fill all those pain medicines and those muscle relaxers and so on. And I found that because hospice can make the patient feel more comfortable, somehow hospice was able to facilitate some of the things that the regular doctor couldn't in terms of medications and other. How does that work?
Yes, doctor. So as I've said, we technically cover everything, related to the comfort of the patient, which includes pain medications, behavioral medications. It is all part of the hospice. And what we do, we get the prescription or the order from our medical director, and then of course we will coordinate that as well with the attending physician, if he or she wants to be involved with the care of the patient. And then we have a contracted pharmacy that delivers the medications to the patient's house or the patient's facilities.
Okay. Now, you mentioned COVID-19.
Yes,
COVID-19, very devastating. Over 100,000 people in the United States have died from that right now. People are in this thing, shelter in place. They're afraid to have somebody come in their home.
True.
And so you're a nurse, you're going to come in the home. I see you have some of your personal protective equipment. Tell me what you would do if you were to enter a home and check to make sure that either the patient or their family wasn't dealing with the COVID-19, or that you weren't bringing that into them.
Of course. We want to protect ourselves and, the other people as well. Everybody's lives is very important. So what we do, first, of course, we have our hand sanitizers. We wash our hands. If we have access to any bathroom or any, sink, then we definitely needs to wash our hands. And then we can wear our mask. See, we wear our mask, doctor. Something like that. And then we can also wear goggles if we know our patient has, some fluid
If they're coughing,
if they're
or
coughing, if they
wheezing or
have,
sneezing
you know,
or short of
diarrhea,
breath.
vomiting, things like that. And then, this is very interesting, doctor. It is folded like this, but this is our gown.
That's your gown.
Yes. We only
you put
open
that
this.
on.
Yes, we only open this once we reach, you know, the patient's location, and then we wear it.
And you dispose it after
It
you
is
finish
disposable.
with the patient.
Yes, it is
So
disposable.
you don't bring that to another patient's house.
Exactly. So we wear it like this.
Nice.
Right? So make sure everything is protected. And then once we enter the patient's house, what we do is take your temperature.
All right. Okay. And so what if their temperature is up?
So for example, of course we have to report that. We have to report that to our medical director first, and then our medical director will coordinate everything with the PCP, you know, as standard of the CDC and public health, you know, to report cases like that if we have symptoms.
Do you test them? Do you do COVID testing? Like let's say someone was sent home from the hospital or a nursing home and you know that they did have COVID positive. Would you test the family when you went in?
It is coordinated with everybody, like the hospice, the medical directors, and the PCP, and then we have to report to public health. For example, patient is in a facility, then facility will report it to public health. For example, public health of Oakland, you know, and then they will do the testing themselves. So, of course, it's all about the coordination from hospice to the right person.
Okay, Miss Grace Lizardo, you're a registered nurse.
Yes, doctor.
And you are one of the primary care health leaders that goes out into the home to take care of the patients, see what they need. It could be cancer, it could be a stroke, you said, it could be dementia, it could be COVID-19, it could be chronic obstructive pulmonary disease, or any one of these disorders, and probably a combination or others thereof. You provide the care, you get them the medication, whether it's antibiotic. What about palliative care? What if they're saying, I still want some treatment, I'm not ready to go?
Okay, so Bristol Hospice will launch very soon the AIM program. It is the Advanced Illness Management. So if a patient is not ready to stop treatment, then they will be enrolled to AIM program.
So you find a way to treat them where they are and whatever the things that they need.
Yes.
Okay. I'm Dr. Jeffrey Watson. We are so appreciative to have had Bristol Hospice here with us today. They clearly described that health is a state of spiritual, socioeconomic, psychological, physical, and well-being in your home. Okay? That's what health is. That's what Bristol does. That's what hospice does. It is not a house, but they will come to your home. We thank you so much for being with us, Miss Lizardo,
Thank you,
registered nurse, and Miss Shake, masters in social work, right here on the Healthbeat Show, where you'll always hear me say that your health is your wealth, and when you have your health, you have everything. We'll see you next time.
The Healthbeat Show, sponsored by Watson Wellness Water. Your health is your wealth.
The AAWP Medical Minute is sponsored by the African American Wellness Project.
Hypertension is much more common in African Americans. But is table salt to blame? I don't know exactly what to tell you. Some experts suggest that too much salt is a problem. Others are worried about too little salt. For most of us, a little more than a half a teaspoon of salt a day is sufficient. But for people over 50, those with hypertension, and African Americans, much lower amounts are recommended. But there's no conclusive evidence for these amounts. And too little salt can be a problem for people with heart disease. I believe you should control your salt. But remember, most of the salt does not come from the salt shaker. So if you need to cut down, read labels. As for my specific advice on how much salt is too much, it may not be scientific, but my grandmother had an answer: a little bit more than a pinch. I'm Dr. Mike Lenore with the African American Wellness Project. This message is sponsored by the Dan Weinstein Family Fund.
So they say it's a man's world? I don't see anybody's name on it.
While they were doing their thing, we slowly changed all that.
Today, women can do anything men can do. And there's one thing we're even better at.
I'm Dr. Jeffrey Watson, and you should know your numbers. A lot of people don't know what high blood pressure usually is. Any number above 140 on the top number and above 90 on the bottom number is considered phase 1 of hypertension. If your blood pressure is above 160 on the top number and 100 on the bottom number, that's phase 2 of hypertension. Now, African Americans make up about 12% of the U.S. population, but they make up greater than 30% of all people with high blood pressure. High blood pressure is associated with heart attacks, it's associated with strokes, and it is taking us out at a disproportionate amount. Make sure that you keep a low sodium diet. In other words, don't sprinkle any salt on your food, and look on the boxes, look on the cans, take in less than 2 grams of salt a day. Keep your weight down and try to keep that stress down. Go for walks, go for jogging, and try to meditate and think about those things that are bringing you stress and try to take those away. High blood pressure is thought to be a silent killer, but if you have pounding in your head, if you're feeling dizzy, if you feel tense, if you are fatigued or you have palpitations in your chest, these may be signs and symptoms of high blood pressure. Talk to your doctor about it. I always say that if you knew better, you could do better. I'm Dr. Jeffrey Watson, and remember always that your health is your wealth, and when you have your health, you have everything. I'll see you next time.
If you have a business, product, or service and would like to advertise on Healthbeat, contact us. We feature affordable advertising for small, growing, and established businesses. Reach an accessible audience to over 4 million viewers. Promote the health and wealth of your business and give us a shot.
For advertising and sponsorship opportunities, log on to healthbeattv.info.
I'm Dr. Jeffrey Watson. Thanks for being with us on this episode of the Healthbeat Show, where we try to educate you about different aspects of healthcare, about eating right, exercising right, what you can do to help yourself, how to access the healthcare system, what kind of questions to ask, what you should do for any particular disease state. Because I always believe that your health is your wealth, and when you have your health, you have everything. I'm Dr. Jeffrey Watson. We'll see you next time.
You don't have to take my word, but I heard if you have your health, you have everything. Take my word, but I heard about the Healthbeat. You're good.